o'clock to respond to and prevent the spread of COVID-19 in Wisconsin. And as I've said all along, we've been guided by science and public health experts to do what's best to keep our families, our neighbors, and our communities safe. It was a little more than 3 weeks ago now that I sat in this very chair and I asked for your help when I announced our Safer at Home order. I had met with business leaders and local health leaders, and overwhelmingly, we needed an all-hands-on-deck approach to stopping the spread of COVID-19 in Wisconsin. Each and every one of us had to do our part to make sure that our healthcare workers and system didn't become overwhelmed by an influx of cases. I've said all hands on deck meant you too, and by golly folks, you delivered. From businesses like La Crosse's Distillery that started making hand sanitizer last month and is partnering with the Badger State Sheriff's Association to deliver hand sanitizer to every sheriff's department in the state, to folks at the Allen Centennial Garden helping keep up the spirits of healthcare workers at UW Hospital by donating hundreds of indoor plants from the greenhouse, to folks like Ashley from Monticello who donated her salon's supply of masks and disinfecting supplies to her local post office. And Larry from Mauston, who is a diesel mechanic who's still working and making sure our truck drivers can get their goods to market. And educators who are still working to keep teaching, inspiring, and empowering kids across our state, like Mrs. Krieger from Mountain Bay Elementary, who reads a chapter from a book to her students every night. To the folks across Wisconsin who are picking up groceries for their neighbors, disinfecting hospitals and doctors' offices so they're safe for healthcare workers and their patients, running child care centers, stocking the grocery store shelves, and making food so our restaurants can keep their doors open. And to the untold stories of folks across our state who are making sacrifices, who are trying to make ends meet, who are doing their best to get by, who've kept their families, their neighbors, and their communities healthy by staying safer at home. A few weeks ago, we had a pretty grim outlook for what COVID-19 could mean for our state. According to the model created by the Department of Health Services, Wisconsin was projected to have between 440 and 1,500 deaths from COVID-19 by April 8th. But Safer at Home is working, folks, and it's because of all of you that we are where we are today. In the first 3 months of Safer at Home, our data shows that we have saved at least 300 lives and perhaps as many as 1,400 lives. We have helped flatten the curve, which has resulted in fewer cases and hospitalizations, and folks, we've saved lives together. But as I said all along, I'm going to rely on the science and public health experts to help us guide us through these challenges. Because at the end of the day, my bottom line is keeping people safe. And we're not out of the clear just yet. COVID-19 has been and still is a situation that sometimes changes by the hour. And that's why, just as I did 3 weeks ago, today I'm asking for your help. Earlier today, we announced that K-12 schools will remain closed for the remainder of the school year, and we are extending our Safer at Home order until May 26th. And I need all of you to continue doing the good work you've been doing so we can keep our families, our neighbors, and our communities safe, and so that we can continue flattening that curve so our healthcare workers and system can continue saving lives. Our new Safer at Home order includes the important protections that are keeping people safe, but it also includes some new flexibilities. This order will allow businesses new opportunities to serve customers, including deliveries and curbside pickup, while keeping their workers and customers safe. We're making it safer to shop at large retailers by implementing social distancing at stores like Target and Fleet Farm. Craft stores will be able to more easily get folks materials they need to make their own face masks and coverings. We're also allowing people to pick up the latest novel or children's books from their local library through curbside pickup. And with the weather hopefully starting to warm up, you'll now be able to get outside and play a round of golf with some common sense restrictions. You can still get out to take a walk, go for a bike ride, or walk the dogs. It's good exercise, and it's good for everybody's mental health. But please don't take any unnecessary trips and limit your travel to essential needs like going to the doctor, grabbing groceries, or getting medication. Now, I know a lot of folks are concerned about the effects this will have on workers and businesses across our state. And believe me, no one wants to reopen our economy as much as I do. But the bottom line is that our businesses, our workers, and us as consumers can't be confident if we're not confident about our safety and our health. We can't think of this like flipping a light switch. It's like turning a dial. The more disciplined we are now, the faster we can turn it. Now, I want to be honest with you folks. Things won't get back to normal until there's a vaccine and treatment for this disease. And even then, our new normal will not be the same as our old normal. This will be a slow and gradual process. Let me be clear. This will not be like turning off a switch, but rather a dial that we can turn to ramp down safer at home so that we can safely get back to our way of life. However, we know what we need to do to move forward. Our team at the State Emergency Operations Center has been hard at work developing a plan that will allow us to safely reopen our economy. I've been talking with business leaders and entrepreneurs, and so have members of my cabinet. I've also been communicating with governors around the country, particularly our neighbors in the Midwest. Here in the Midwest, we are bound by our commitment to our people and the community. We recognize that our economies are all reliant on each other, and we must work together to safely reopen them so hardworking people can get back to work and businesses can get back on their feet. Earlier today, I joined a bipartisan coalition of governors in announcing that the states of Wisconsin, Michigan, Minnesota, Illinois, Ohio, Kentucky, and Indiana will work in close coordination to reopen our economies in a way that prioritizes workers' health. Our number one priority when analyzing when best to reopen our economy is the health and safety of our residents. We will make decisions based on facts, science, and recommendations from experts in healthcare, business, labor, and education. Phasing in sectors of our economy will be most effective when we work together as a region. This doesn't mean our economy will reopen all at once or that every state will take the same steps at the same time, but close coordination will ensure we get this right. Over time, people will go back to work, restaurants will reopen, and things will get back to normal. Moving forward, we know that businesses need some clarity so that they can begin to plan. How can they make their customers feel safe? How can they make their businesses safe for their employees? And how can they implement appropriate social distancing? Well, here's how we'll do it. First, we need a massive expansion of our testing capacity. We've been steadily increasing our testing capacity for weeks, and private labs and more private labs continue to come online. That capacity will need to increase significantly. This will require us building our existing strong public-private partnerships that will serve all of Wisconsin. In order to support a dramatic increase in testing capacity, we will also need to grow our healthcare workforce and have sufficient personal protective equipment to ensure our workers are safe. We also need PPE for many of our critical workers to safely do their jobs. Right now, despite our state's ongoing efforts to get our fair share of supplies from the federal government, our successful PPE donation and buyback programs, and our aggressive procurement efforts, we still do not have enough PPE to keep all our workers safe, which is why we're working with health systems and businesses to implement decontamination strategies of our existing PPE so that we can safely bolster the supplies we have. So as we work towards safely reopening our economy, we're going to need a lot more PPE. The state continues to pursue this equipment through every avenue. Our members of Congress are great partners in pushing the federal government to do its part, and some Wisconsin businesses are already stepping up to help manufacture these supplies. In addition to expanding our testing capacity and acquiring more PPE, we will need to greatly expand our contact tracing efforts around the state. Once we've identified someone who is infected, it is imperative that we find out where they have been and who else they may have exposed. The more folks stay safer at home, the easier it is for our public health officers to trace their steps and contact others they have been in contact with. But when we're dealing with situations where someone who is sick has been in contact with dozens of other people in several different settings over a course of a week or more, it is much more of a challenge to track down everyone who might have been exposed. Contact tracing can be difficult and time-consuming work, but it is an essential program and a component of our plan to safely reopen our economy when the science tells us the time is right. These major components, more tests, more PPE, contact tracing, along with daily analysis of the scientific data, will be the metrics that guide us going forward. At the end of the day, we have to remember we're all in this together, folks. And while we may not be all in the same boat, we're all weathering the same storm. So thank you for the work you've been doing by staying safer at home, and let's keep up the good work, Wisconsin. And with that, I'll turn it over to Secretary Andrea Palm.